Thank you for coming in because I know your schedule is very tight.
Oh, thank you for asking me.
Yeah.
Thank you.
I'm very happy with the result.
That's what we want to hear.
Yes, I'm very happy with the result.
You're listening to Radio Alicia 90.1 FM. Stick around because we have special guests today in the show. Dr. David Mackenzie is here, and also Andrés Ramírez from Los Hispanos de Vanguardia is here. So we'll be talking about a new revolutionary technique. He's a chiropractor here in Vancouver. And they specialize in spinal decompression therapy and laser therapy, no? So why don't you tell us a little bit about what you do?
Well, we do a number of things. Been a chiropractor for 45 years. About 13 years ago, we got into a new technology called spinal decompression, which is a non-surgical treatment for a herniated disc or a bulging disc or a degenerative disc. We've probably done over 100,000 treatments since we started doing that 13 years ago. So these are for patients who have disc problems that either aren't appropriate for surgery or the patient doesn't want to do surgery. And then about 8 years ago we started adding to the treatment regimes that we do with cold laser, which is laser's been around for quite a while, but it's just gotten into the offices in the last 5-10 years. So it's a very effective treatment for a lot of soft tissue conditions, and we use that in conjunction with the spinal decompression for the disc problems.
Yeah, I was gonna say it's not that of a technology, but it's just recently that started to being applied.
That's correct. That's correct. It's becoming more common in offices now, yes.
Was it because it was expensive to treat, or because there wasn't enough education about it? Or?
Well, I think a combination of things. It takes a while for healthcare professionals to accept new technologies. And then once they do, there's always an inherent cost in acquiring the technologies also. And it can be a fairly pricey piece of equipment. So that's probably one of the things that slows people into acquiring the technology.
So we got a couple of questions from people that send us. We'll get into that a little later in the show. But tell me a little bit more about where people can find you.
Well, we have a website, Mackenzie, Mackenziesdi.com. That's our website. The office is in Coquitlam. We've been in the same location for 45 years now. So that's how you find us.
Yeah, as soon as we announced that we were going to have a chiropractor here, a lot of people send us messages. I guess there's a lot of patients, no? A lot of people with back problems, with what other ailments do you treat?
Well, we treat, we're doing a lot of knee problems with the laser, a lot of tendinitis problems, tennis elbow, plantar fasciitis, Achilles tendinitis. Pretty well any soft tissue condition will respond to the laser.
Dr. Mackenzie, what is the reduction of the pain as soon as you start treatment?
Well, the laser affects the tissue at the cellular level, and it helps reduce the inflammatory process, and it helps reduce the swelling process. And so once you start to reduce those two things, the pain starts to subside.
So no more pills?
Well, hopefully that's the case with most patients, yes, absolutely.
So how does the laser work in the body?
Well, the laser, the scientists have figured out, so if you look at, in my explanation to patients is, if you look on a sunny day, if you look at the sunshine, it's made up of different spectrums of light. So there are different light waves that make up the sunshine. And so the scientists have located certain specific wavelengths of light that will evoke a healing response in the tissue. And specifically on the cellular level, there are, in our body, my explanation again to patients is there are organs that run the body. There's the heart, the liver, the lungs. But at the cellular level, there are little organelles that run the cell. And one in particular is called a mitochondria. Looks like a little cigar in the cell. And the specific wavelength, so the mitochondria is responsible for DNA reproduction and healing in the body. And the specific wavelength that we use stimulates the mitochondria, and that accelerates the healing process.
Okay, yeah, very interesting. No?
Very. I think this treatment is for every joint pains, right?
Yes.
So it works for arthritis too, like
yes.
arthritis patients.
Yeah, we've got some patients with severe arthritis in the knees that it's not 100%. Nothing is 100% cure. I don't want to use the word cure, but nothing's 100%. But we have some very severely arthritic knees that respond very well to the laser.
Yeah, actually, I'm getting a little bit ahead of the question. That was one of our listeners, Rachel. She was asking about if it's good for arthritis.
So Osvaldo, I think in my personal opinion that this treatment could be the primary treatment for those issues instead of surgery, right?
For many, yes. It helps people avoid surgery or prolongs the need for surgery. A lot of people don't want to have surgery on the knees, and the older you get, the less likely it is to. I realize your audience is probably not an older audience, but a lot of older people don't want to have surgery on the knees, and the laser helps keeps them going very well.
Yeah, we'll talk about that because we have a question regarding that as well from Oscar. So, but let's listen to some music. Let's play the new Escape song. This is brand new from Spain, Escape. It's called Jaque al Rey. And we'll be right back here at Radio Alicia. We're speaking with David Mackenzie, Dr. David Mackenzie.
Checkmate.
Tell us what does a chiropractor do for people that don't know?
Well, primarily the core of what we do is we deal with spinal problems, primarily misalignment, the vertebrae in the spine or the pelvis, and that will irritate nerve endings and cause pain and disability and different symptoms. So our job primarily is to align the spine. There's a lot of other conditions that chiropractors do
like
treat. But
scoliosis and stuff like that?
Yes, scoliosis. I personally don't deal with a lot of scoliosis, but certainly many of the patients that I do have a form of scoliosis. So that's primarily what we do.
Hernias, disc hernias?
Herniated disc, yes. We don't deal with that through chiropractic adjustments usually, but we, as I told you earlier, we have a new technology we've been using for about 12, 13 years now called Spinal Decompression, and that's a non-surgical treatment for herniated disc. And yes, we do treat herniated disc with that a lot.
Okay, so one of the questions Oscar is telling us, he had a really, his knees are busted. He said he had the problem is the cartilage in his knee is pretty much destroyed. So he's asking if this would be an option for him to avoid the surgery in his other knee.
Yes, it could be, absolutely. Obviously you have to examine the knee and probably x-ray it. But that's definitely an option, and we do a lot of knees that sound like what Oscar has.
Mm-hmm. Well, guide us a little bit about the process of, let's say, an average person that has a back problem. What's the process of the treatment?
Well, in my office, patient comes in, we do a consultation, take a history, see if there have been any injuries, any familial occurrence of spinal problems. Then we would do a physical examination. And with many of my patients, we'll also take x-ray. We have x-ray on site, and it certainly gives us a real visual perception of what the problem is. And then we make a diagnosis, and if we think that it's appropriate, recommend a treatment program for the patient.
Mm-hmm. And then I guess the treatment depends on the severity of the lesion or
Yes.
the patient, no?
Age of the patient, condition, severity, length of time, what we see on the x-ray. So each patient is obviously unique, and we treat each patient, each patient is treated according to what we find out on the diagnosis.
Mario's asking us if this would work for the gout symptoms.
Well, there's always, with the gout, there's usually inflammation and edema, and that can be a very painful condition.
Mhm.
So, yes, it potentially could help reduce the gout symptoms.
The gout symptoms.
Yes.
He
Yes.
said his feet hurt when he got his gout attacks.
Yes. Yeah, so we have patients with severe rheumatoid arthritis in the hands, and a lot of them have responded very well. And although gout isn't rheumatoid arthritis, it's kind of in the same family, and so I would expect that it should, with many patients, it will respond well.
Raquel is asking if you think, what do you think about Reiki? I don't know.
Well, that's a good question, and I appreciate the question, but to be honest, I don't really know all that much about it. It's been around for a long time, and a lot of people find good results with it, but I by no means am qualified to respond to that. I don't know that much about it.
Okay, we're talking with chiropractor David Mackenzie. So tell us again the website and where can people find you?
All right, website is Mackenzie, Mackenziesdi.com. And we're in Coquitlam on Austin Avenue.
Okay. And we're answering a couple of questions from the listeners. So Martha, she says she has arthrosis. I don't know if that's the name in English too. Arthrosis.
Arthrosis,
in
arthritis,
the hip,
yes.
And the hip.
Yes.
And affects the leg, the left leg, and she cannot. It hurts and it's heavy to move because of that problem in the hip. Is that something that this new technology can help?
It again depends on the diagnosis. Sometimes patients will have pain in the hip, but it's actually originating in the back.
Mm-hmm.
If it's the actual hip joint itself, it depends on the severity of that. So I can't, unfortunately, give you a real hard answer, but there is a potential, yes, that
There's
it
a
could
potential,
be. Yeah.
from because I guess it's also cartilage, no, in the hip that gets worn out
Yes.
with the age.
in the
stuff.
hip joint per se, and
Uh-huh.
some people are more prone to it. It happens. It's a hereditary susceptibility, and then some patients through just wear and tear and injuries. But if it's the actual hip joint itself, depends on how severe it is. If it's
Mhm.
not too severe, it could be helped.
Could be helped. Okay, and they say also that I twisted my back while bent over and have had pains ever since. I went to see a psychotherapist, but there's only so much they can do. It seems like it's like a herniated disc style, but it only really hurts when I'm sitting for long periods of time or if I don't move. But walking, hiking, backpacks are all okay. So I don't know, what do you think?
Well, obviously, there's some issue there. So it certainly could be a disc. It could be a misalignment. Could be a combination of the both. Could be a misalignment, creating some bulging of the disc. So that's possible. But it's obviously good they can hike and walk and everything. But sitting in pain is not a good thing.
Yeah. So what they should do is when they come to see you, then you do a diagnose. You take X-rays, or how do you?
Yeah, typically we would X-ray the patient, and that may not be the end of the diagnostic procedures, but most of the time we can make an accurate diagnosis with the X-rays. Yes.
Okay, so Gabriel said that he has lower back pain, but he doesn't have MSP. How much is a session on stuff like that?
Well, that's depends on the severity of the condition. You know, the initial consultation is $50, and we X-ray sometimes, just depending. That could be it's not typically $50 for the X-rays. So, and then we have to determine what type of treatment we're doing, whether we're going to be doing spinal decompression or laser or combination or just pure chiropractic. So at that point, we explain to the patient what they're looking at cost-wise.
Okay. So MSP covers that? Covers the chiropractic? Sometimes? Or?
Sometimes. I would say maybe 5 to 10% of the population do have. There's an income level that MSP looks at, and if you're below that income level, they will subsidize your care. But for most people, there won't be any coverage.
Okay.
Dr. Mackenzie, is any kind this treatment cause pain in people?
The laser treatment, I think that you're talking about specific landers. No, there's no sensation whatsoever. There's no heat, no burning, no sensation at all. So it's totally
painless.
Yeah, totally without pain.
Do you feel it at all, or you don't even feel it?
You know, I've had some laser treatments for some issues I've had, and the only thing I will feel occasionally is like a little flutter in the muscle. But not much. But I don't know why. There's something about the laser that always puts me to sleep. So it's a very it's a very easy treatment.
Okay. Alejandro had a work injury in his neck. Well, his muscle here, I guess. Would that help also to recover? Like a lesion like that, like a traumatism in the muscles?
Absolutely. Of course, each patient is unique, and we have to examine and diagnose each patient. But certainly, it sounds like it's something that could be of help. Absolutely.
Okay. So tell us again, where can people contact you, and so they can get some help or a consultation?
Okay, we're at Mackenzie SDI, MackenziESDI.com, and our phone number is 604-939-2201.
Okay, and there's you're in Austin, no? Austin Avenue in Coquitlam.
Yes, yes.
And there's an ad there in Hispanos de la Vanguardia, no, Andrés?
Yes, if they found Hispanos de Vanguardia, they're gonna find Dr. Mackenzie for real.
Yeah, and Andrés, it's a patient too, no? So tell us about your experience with the
What can I say,
the treatment.
Man? I gotta be honest to the listener of this program. When I got here, I have several pain in my back. My lower disc was all messed up, and then I went to see Dr. Mackenzie because I found him in an app in another newspaper. So I just give it a try, and I went to see him, and I was taking pills all day, and as soon as I get there and he treat me, the pain went away. I feel a lot more better. Now I can walk, like everybody does. Before I couldn't even move. And now, man, I'm very happy with the treatment, and this is a very important message, because I know that there is a lot of people out there that they suffer for this pain and this sickness, and they're afraid to go to surgery. And then I just want people to know that it's a treatment, it's an alternative for the surgery, that it's work. And this is talking, it's a patient, and I know it's work. Very, very, very good.
It works. I guess there's a lot of people that have low back pain. What's the reason of the most common reason of that?
First of all, it could be injuries. Could be a car accident. We treat a lot of car accident patients. Could be a sports injury. Could be a lifting injury. Could be a slip and a fall. So any trauma to the body potentially could create some kind of spinal condition or lower back condition.
Mm-hmm. Is it also common to have with age the back starts to hurt, or?
Well, yes, but a lot of the pain you're feeling as you get older is a result of an injury when you were younger, and it starts to show up as you get older. Or you have pain when you're younger, and if it's not treated properly, or you don't, it'll just get worse as time goes on. So it is more common to have it as you get older. But what I've noticed also with patients as they get older, they're not quite as active, so they're not putting as much stress on the spine. So it kind of works out, it kind of evens out in a way.
Okay. Well, tell us a little bit again the process of the laser. How does it work?
Well,
you have a machine with a laser pointing at you, or?
Yeah. So there's two avenues of applying the laser to the body. Probably 75% of the time, you know, I tell patients it's like a big expensive flashlight. It's about 6 to 8 inches away from your body, and we focus the laser on the area that is going to be treated, and it's again like a big flashlight, and it scans over the body. And, sometimes the patient's lying down, but if they're sitting, they'll wear safety glasses. And there's no sensation, you don't feel anything at all. With joints, for example, with the knee joint, we have a handheld laser that we apply right to the joint, right to the skin. And the laser penetrates about 2.5 inches into the tissue, so it gets right into the joint, but there's no sensation.
Okay, and then the laser pretty much, how does it work to heal the joints?
Well, I want to be careful when I say heal the joint. If the joint's severely arthritic, we're not going to make it a new joint, but we will lessen the inflammation and lessen the swelling. And the inflammation and swelling is substantially responsible for the pain. And in the case of a knee joint, you know, we actually have a fair number of patients that come in that have had knee replacements, but they're still hurting. And the actual knee joint replacement is fine, but it's all the soft tissue around the joint that's causing the discomfort. So we have quite a number of patients that have had knee replacement that are still having pain, and they come in, we deal with the muscles, and things settle down, and they're very happy.
We got a question from a soccer player. He said that if this technique is used now in professional sports and stuff like that.
Yes. Now I can't tell you exactly to what extent, but I'm certain it is. I can't speak of I know when I purchased my first laser machine about 8 years ago. The machine is made in Italy, and it's distributed by an American company. And the Dallas Cowboys wanted a couple of their machines, but they didn't want to pay for them. So he said, no, that doesn't work that way.
Yeah.
So, which I think is fairly common with a lot of professional sports teams. You think they've got a lot of money, and they do, but they know how to grind the manufacturer for free product. So yes, I'm sure a ton of sports teams are using it.
Yeah. Okay. You're listening to Radio Alicia, and we have here Dr. David Mackenzie, chiropractor. He was answering a couple of questions here from the audience. He specialized in spinal decompression therapy and laser therapy, no?
Yes.
And general chiropractor.
Yes.
Practice there. So thank you very much for being here. I don't know if you want to tell them a little bit again, what does the therapies that you do consist on?
Well, thank you very much for having me, first of all. So there are basically three types of therapies that we do. Chiropractic, which we've been doing in Coquitlam for 45 years now. Can't believe it's been that long.
Yeah.
About 12, 13 years ago, we started doing spinal decompression. That's become a very big part of what we do in our practice. That's a non-surgical treatment for a herniated disc or a bulging disc or a degenerative disc. We do take care of a lot of people who have been in motor vehicle accidents. ICBC works with us on that. And we also do laser, and again, ICBC works with us on that, on different injuries. So the laser is a non-invasive, painless, almost sensationless treatment for different soft tissue injuries, a lot of tendonitis problems, a lot of knee problems, a lot of shoulder problems. So it's very exciting, and we do our best that we can to help people.
Yeah, also carpal tunnel, no? And
Yes, that would help, because that's partly a soft tissue and partly a nerve issue also, yes.
And osteoarthritis? Also
Degenerative diseases, yes. Osteoarthritis, yes. Particularly the knee joint, but a lot of hand, a lot of rheumatoid arthritis, osteoarthritis, yes.
Yeah, so check them out. We have here Mr. Chipotles here in the studio.
Hey, how you doing, Osvaldo? Hi. Hey.
Hello.
Pleasure to be here. Very interesting what you're saying about lots of people with these kind of problems, yeah. And I know they need lots of help, and that's what you do. That's great to know.
Especially in construction work, no?
Yeah.
Here in Vancouver, a lot of construction
Yeah,
workers,
my
I guess.
back, my knee, like all people, we work in construction, and it's hard, and we need this kind of therapies. And then you have this laser, so it's even better, eh?
Yes, the last 10 years, maybe 15 years, there's a lot of technologies that have come along that have helped us help people a lot, and it's exciting. It's continuing too.
Awesome. Well, thank you for being here. Remind us your telephone numbers and your website.
Our telephone number is 604-939-2201, and our website is Mackenzie, MackenziesDI.com.
Okay, well, thank you, Andres, also for bringing the guest today. And remember that Los Hispanos de Vanguardia is out in the street.
Y todavía está.